All right, now we're shifting focus to Mumbai, where the nurses' protest continues. Now, this is the fourth day of the indefinite strike that has been called by the nurses. The patient services have been hit. Now, JJ Hospital more specifically, now this is one of the biggest hospitals in Mumbai, where we see people going to the hospital in thousands to receive the treatment. Now, Maharashtra Minister has met the Nurses Association. Now, the Medical Education Minister says that they have agreed to the nurses' demands.
We've been joined by Medical Education Minister Mr. Amit Deshmukh, and he's with us has just had a meeting with the nurses. Let's try and understand how was the meeting and is there any possible outcome. Sir, what you would like to say, how was the meeting and is there a possibility of calling off of the strike?
Yes, I think we met the Association of Nurses of Maharashtra. They have called a strike, and we've discussed all their issues. I think as government and as Medical Education Department, we are in agreement with the issues raised by them. We have promised them that government already has started work on various issues and doing justice to those issues. They are expecting a time-bound schedule. So we've given them a schedule of 45 days within which most of the demands will be met. And I think by evening today or in a couple of days, I hope and expect that they call off the strike and resume work.
So one of the prominent demands was to stop outsourcing through contract. So is it something that the government is considering to stop in the future?
So we've explained to them that outsourcing is only done as a temporary arrangement, and in times of emergency, when in COVID we had to do outsourcing. If we are setting up a new college and you need nurses, to get the permissions from the NMC. So at such times we do have to outsource, but that is not our permanent policy. So our permanent policy is appointment through the government, recruitment rules. So we are abiding by that. So there's outsourcing of nurses will happen through the government recruitment rules. That is an examination, a written examination, a merit list, interviews and appointment. So that is our policy. Outsourcing is just a temporary arrangement which we've explained to them. I hope they will understand.
So one more question, equal pay for equal work they were demanding, as compared to the salaries being issued to the central government nurses. So how it is being looked upon, sir?
So Government of India or central government pay scale is actually a guideline. And, as states, Maharashtra is one of the leading states which takes care of the welfare of people who are working for the state government employees. So if there is something that needs to be done in comparison with other states, which government of Maharashtra is willing to look into and do the needful. So as far as the Government of India pay scale is concerned, the Government of India pay scale and the state government pay scales are different. So we also need to take note of that. Yeah.
Lastly, sir, medical services across the districts have been affected. Are you still hopeful today they will call off the strike after this cordial meeting?
I think the meeting has gone well. They are going to have discussions with the Health Minister, Mr. Rajesh Tope, as well. So hopefully, we'll be on the same page and the strike will be called off, is what I hope. And I also appeal through your channel that the nurses call off their strike and resume work. We are with you. There is no issue at all.
Thank you so much. That was Mr. Anil Deshmukh, and he clearly said that we are with the nurses and appealed to the nurses that please call off the strike for the betterment of medical services in Maharashtra.
All right, that is the big breaking news that Abhishek is getting to us, saying that the government has decided to agree to all the demands that have been made by the Nurses Association. Now, remember, this comes in the backdrop of a massive protest and a strike that the Nurses Association in Maharashtra currently is undergoing. Its day 4. Now, they have been demanding essentially two things here: to stop the outsourcing of employment, and second, equal pay, equal work. Now, the government says that they have agreed to all the demands and hope that the strike will be called off. Now, remember, this is essential because the medical services in the city have been hit. They're seeing an impact in terms of, because all the nurses there on your screens are on this strike, and hence their services, they're unable to give their services at the hospital to the patients who need it the most. All right, now that's a big development that we're reporting here on this Sunday afternoon, where this is with respect to the nurses striking in the state of Maharashtra. The Maharashtra minister there telling Mirror now that they are in agreement with the nurses and they will look into their demands. They've told the Nurses Association to give them a time of 45 days to implement everything that they want. Now, the two major demands have been that of removing this system of outsourcing the nurses, because the nurses feel that there is a disparity in the pay when it comes to outsourcing the employment. And the second one, they're demanding that their pay should be equal to the central government rules and what the central government employees get. Now, Abhishek, who has been tracking this story closely and the one who got us that reaction from the Maharashtra government, joins us live on the broadcast. Abhishek, clearly there seems to be some sort of agreement. At least the minister here is saying that they have agreed to, meet all the demands of the nurses. So does this mean now that the Nurses Association will call off their strike?
Yes, definitely. It was a positive meeting as the minister briefed us, and at the same time, he also said the meeting, 45 days time-bound assurance has been given, and now minutes of the meeting is being prepared and a written assurance will be given. And what we also got a small press note from the Nurses Association is that as soon as they get the minute of the meeting and written assurance from the minister's department, they will call off the strike. So definitely after 1 week and 2 days, around 7 days, the strike will be called off as soon as the nurses will get the written assurances. And as far as the demands are concerned, the two prominent demands, first importantly, stop outsourcing. As we asked the minister clearly said that, we explained to the nurses that we are not, this is just a temporary and alternative provision. And that is also we are using, because at the times of COVID, we need to bring up new hospitals and sudden recruitments are there. That's the reason we have, taken up outsourcing. But no way we are planning to take it in future, and definitely in 45 days time-bound assurances given by the minister, this provision will also be ruled out. And as far as the equal pay for equal work is concerned, when they were demanding that they should be paid on the lines of the central nurses, he clearly said that there are different rules. The central pay scale is totally different from the state pay scale, but what best can be done is something we will definitely do for the nurses. And also what minister told, that a meeting will be also held with Rajesh Tope, the health minister. Other concerns are also being raised that will also be discussed. For sure, when we directly asked him that medical services across the state, including Mumbai, have been hit by this nurse strike, he again appealed through our medium, through Mirror Now, to all the nurses that please come back to work. We are in same pace, and definitely your all demands in the time-bound manner will be meted out in future. So definitely a positive move from the government side, and what we expect is by the evening, as the nurses get the written assurances from the department, they will also call off the strike. And good news for the medical services which were constantly affected across the district and even in Mumbai, the medical services will soon resume as per the meeting's conclusion is. Back to you.
Well, right, Abhishek, written assurance is what the nurses need at this point, and we hope that this, this whole resolution, this matter reaches a logical conclusion and the services are restored. Thank you so much for joining us and getting us all those details. We're in fact taking an extremely short break here. There's lots lined up on the other side. Stay tuned.